Ottawa's COVID trends are on the rise. According to data from OPH, average active COVID hospitalizations are more than 5 times higher than 2 weeks ago, all amid concerns over a new wave and COVID-19 mutations. For more on this, we are joined by Raywat Deonandan, an epidemiologist and associate professor at the University of Ottawa. Thank you so much for being here.
It's my pleasure.
There are early signs that we are entering a fall COVID-19 wave before updated boosters are available. How concerning is that for you?
Well, it's always concerning in the sense that we're going to have increased transmission without a doubt, and that's going to lead to increased hospital traffic and possibly increased deaths. But concern is not the same thing as alarm. We know what to do. We just have to go ahead and do it.
That's very good to hear. What is behind this latest spike in cases? Is it waning immunity, a new subvariant playing a role?
Everything, but the new variants are definitely playing a role. In Canada, it's EG5, a child of XBB, which is a child of BA, which is a child of Omicron, which is a child of the original COVID strain. So there's a big family affair, super variants causing all of this. Waning immunity is definitely a thing. It's one of the reasons we're looking forward to the new booster coming out in the fall. It targets XBB, which is a closer relative to the dominant strains that are circulating right now.
Can you tell us more about this new virus that we're hearing, variant BA.2.86? Is it on your radar?
Yes, it is. Now, it's only in a handful of countries and only a handful of cases in the USA. No known cases so far in Canada. But do keep in mind, we're not really testing all that much and doing very good genomic surveillance. So there's probably more of it than we think. It's concerning because it has a lot of mutations. And more mutations means a higher likelihood of evading things like vaccines and treatments and tests. But again, it's way too early to know for sure. It's unlikely it's going to be more severe, but it is likely to be more contagious.
What is your prediction for this cold, flu, and COVID season?
It's going to be bad, as has been the norm these last few years. But again, we know what to do. Wear a mask in crowded indoor settings, especially healthcare settings. Use rapid tests to keep yourself out of circulation if you're positive. Get the updated booster when it's available. And just be responsible citizens. I think we all know what to do. And if we do them, we can get through this quite well.
Would you expect to see more COVID hospitalizations? And if so, what effect could this have on our healthcare system? We already know it's fragile.
Yeah, definitely there could be more hospitalizations. In Ottawa, the trend is already up. In the USA last week, hospitalizations are up, I think, 12%. Deaths were up 8%. So if we're going to follow that trend, we're going to say the same thing here. Our healthcare system is so fragile right now. I don't think people fully appreciate how fragile it is. Or maybe they do. If you've gone to the hospital for any reason, you know that service is slow and unreliable because of the lack of human resources, frankly. So every additional person in the hospital for a preventable reason is an additional strain on our system. All of this is constantly worrying.
Now, I know you already spoke about masking, but what other precautions should we be taking in Ottawa to slow down the infection rate of this newest wave?
I don't think people are using rapid tests as much as they could or should. If you test positive on a rapid test, you can take that to the bank. If you test negative, it's not entirely sure that it's a negative. So we can use rapid tests to get ourselves out of isolation if you're currently positive, but also just test regularly if you have a surfeit of tests to make sure that you're probably not infectious to other people. That's a big one. The other thing is to really consider ventilation. As a society, we have not ventilated well things like classrooms and offices and homes and things like that. So if you have the opportunity to open a window or to be in a sparsely crowded place, then that's a good thing as well. The boosters are a big thing. It's an easy thing for us to do, and I think everyone should roll up their sleeves and get a booster if you're eligible.
Thank you so much for all this good information. Raywat Deonandan is an epidemiologist and associate professor at the University of Ottawa. Thank you so much for joining us.
It's my pleasure. Thank you.